Hello everyone. Today we are going to talk about an interesting topic known as hemangiomas. Hemangiomas basically are a cluster of blood vessels that get entangled inside any organ or tissue of the body, and it can result in various symptoms depending upon where it occurs. This is also very commonly seen in infants or newborn children, जहाँ पे कि अगर ड्यूरिंग द बर्थिंग प्रोसेस अगर चाइल्ड को कोई इंजरी होता है, स्पेशली इन केसेस वेयर देयर हैज़ बीन सक्शन अप्लाइड ऑन द हेड to take out the baby, or if there is some during the birthing process there is some force that has been applied which can cause the delicate skin, the blood vessels that are present under that delicate skin to rupture and result in this condition. And this is also commonly known as a strawberry mark in newborn infants. ये जो सिम्टम्स हैं ये बेसिकली अपने आप रिजॉल्व हो जाते हैं आफ्टर अ फ्यू मंथ्स ऑफ बर्थ, और समटाइम्स इट मे टेक अ लॉन्गर टाइम बट इट यूजली गेट्स रिजॉल्व इटसेल्फ. बट इन केसेस जहाँ पे ये खुद नहीं जाते हैं वहाँ पे ट्रीटमेंट में बी रिक्वायर्ड इफ़ दे कॉज एनी प्रॉब्लम्स. अदरवाइज इट कैन रिमेन जस्ट एज सच एंड इट डजंट कॉज एनी प्रॉब्लम टू द चाइल्ड. अगर एडल्ट्स में बात करें तो डिपेंडिंग अपॉन वेयर द हेमेंजियोमा अकर्स, फॉर एग्जांपल इफ़ वी टेक अबाउट say depending upon which organ they are getting affected, those accordingly the symptoms may be present and that can be treated accordingly. Now depending upon the hemangioma की हम classification कैसे करते हैं, so there are usually three types of hemangiomas. So first one is the most common one that is seen, usually superficial hemangiomas, in which the skin, usually just under the skin there is a blood vessel that is present and that results in this problem. Now in this case the color of the hemangioma may be dark red or bright red in color. Now in cases of the deeper tissues that are involved, if the hemangioma occurs in the more deeper tissues, for example under the connective tissues or near the organs, in those cases the color of this may be very dark or dark bluish gray in color or bluish red in color. And then there are the third type, which is the mixed type, which have the components of both the superficial and the deeper ones. Now depending upon the symptoms of hemangioma, if we talk about a liver hemangioma for example, then in those cases patient को loss of appetite हो सकता है. There may be vomiting, the patient may have problem with bloating or excessive bloating, especially after the meals, and there may be also loss of appetite, nausea, and in some cases some other problems may also arise. Depending upon cases where the stomach is involved, then they may have problem in gas formation, or they may have heaviness immediately after eating of meal, or if the liver is causing effect on the stomach, then that can also result in difficulty in passing the food properly, or there may be other issues. Then depending upon if the airways get affected, then there may be breathing problem in the patient. And in case the eyes are involved, or especially in the supraorbital region, if there is this benign tumor, then this can cause pressure on the eyeball or in the optic nerve and result in loss of vision or vision problems. Now depending upon, so these were some of the common symptoms that arise from depending upon where this benign tumor of the blood vessels is present, and depending upon the complications, like what may happen if this increases in size or it causes more severe issues, then that can be some mechanical complications like rupture, which may be either spontaneous rupture or due to any physical trauma that blood vessels get ruptured, then can cause severe complication. If the tumor is large and it causes compression against the surrounding tissues, then that can also lead to severe problems in some patients. There may be bleeding complications, especially if the benign tumor itself gets ruptured inside itself, or outside the tumor the blood vessels get ruptured and the bleeding occurs around the surrounding tissue. Then that bleeding complications can cause a blood clot formation and cause further severe problems in the organs that are affected. Then there may be degenerative complications such as clotting of blood or calcification or scar tissue formation if this is not resolved by itself. Now, depending upon what the symptoms are and if they are the case is not severe or if it is mild, depending on that, homeopathic medicines can be given if the tumor is less than 2 centimeters or 5 centimeters to help it dissolve gradually. In those cases, however, it has to be seen that this is not causing any severe complications, or where the organ that where it is present, if that is not getting affected. Now, if we speak about that, then there is one problem that has been seen, that usually the patients, because of the symptomatic symptoms, usually prefer to go for surgery. However, sometimes these hemangiomas are not harmful by themselves if they are of small size, but if they are large and if they are causing severe problems to the patient, or there is some complications as discussed earlier, then surgery may be required. Otherwise, in homeopathy, there are some medicines such as thuja, calcarea floor. Then there are medicines hemangiomas, arnica. If there is some injury and after that the hemangioma has occurred, then arnica or ruta or any other medicine, depending upon what the symptoms the patient is having, those can be given. If, for example, around the eye the hemangioma has formed and there is bleeding and rupturing of the blood vessels around the eye, and to help extravasation of the blood, medicines such as ledum or arnica or ruta can be given, which are really helpful to dissolve those blood. Then, in case of liver hemangiomas, medicines like calcarea floor, syphilinum, or even some other medicines like depending upon if they are having stomach symptoms or nausea, vomiting and those kind of stuff, then medicines such as ipecac or natramur or calcarea carb, depending on what they are experiencing and how they are reacting to their symptoms, those medicines can be given to the patient. Then there are some other problems that the patient may face, and those are depending upon many other problems like there are some other issues, like if they are having the problem in the airways or breathing problem, then in those emergencies, of course, we have to remove the benign tumor so that the airway doesn't get obstructed or restricted. Otherwise, many medicines, if are started on a regular basis and before the tumor gets enlarged, then those can be resolved and treated nicely. So this was a brief introduction and information about hemangiomas, and I hope you enjoyed watching the video, and in case you liked it, please like and share, and have a great day.